Hello and welcome to the peritoneal dialysis education for St. Joseph Medical Center. This video will take you through all of the steps to connect the patient to the Liberty peritoneal dialysis cycler. This cycler is the style that most patients in our area use. There is another option, however, we don't see it very frequently, and what you'll be using most often is the Liberty. The objectives of this video are to demonstrate the process for initiating and discontinuing peritoneal dialysis, which is referred to as PD, using a Liberty cycler. We're also going to demonstrate the process for a sterile PD catheter dressing change, and we will review the EMR documentation that is required for this procedure and the ordering requirements. First thing we're going to talk about is consent. Patients who are going to be having peritoneal dialysis while they're in the hospital will need to have consent signed. You need to do this before calling the supervisor to deliver the PD equipment. The order for consent should be placed by the renal provider, just as any other consent, and it will read peritoneal dialysis. This consent, once signed, is good for the entire admission.
Hello. So when going into a room getting ready to set up your dialysis PD machine, you need to make sure that you have enough masks and gloves for everyone just setting up and then for the patient as well. So you will have to have a mask, your patient needs a mask, and anyone else, any family member that's in the room or anyone in there assisting you. And then everyone that's going to be touching the machine needs to also be wearing gloves. Hello, today we're going to talk about how to set up a Liberty PD machine. This is for peritoneal dialysis, for those who are unfamiliar with that. That is where they do dialysis, and it goes into their belly, does all the work and pulls out all the stuff and then goes into a bag. Majority of our patients here at St. Joseph use the Liberty, so we're going to teach you on how to use the Liberty. This will get brought up to you by the supervisor. They are kept downstairs. She will bring you up the machine, a bag with the supplies, which has a new cap in it, the collection bag, and the cassette that goes in the machine. She will also bring you up the fluid that is needed. You will know how much to tell her to get when you get the order. Look at the order. It will tell you how many fills that they will get and how much is getting put in them during each fill. So in order to know how much bags and fluid you need to tell her to give you, you need to take the fill times the liters. So for example, the majority of our patients get 2,000 mils at a time, and they get anywhere from 4 to 6 fills throughout the cycle. So if they have an order for 5 fills and they're getting 2,000 mils each time, that means that you need to make sure that you have 10,000 mils for the shift. Our bags are all 5,000 mils, so that means you should get 2 of these.
Let's talk a little bit about that math again. It's quite a bit to take in just listening to it. So this slide shows how you're going to do your math. We're going to have some screenshots of your orders a little bit later, but let's talk a little bit about what Sasha was discussing. When you're going to have to do this before you request your supplies from the supervisor. So your patient's going to have orders for CCPD. And in that order, it's going to say the number of fills, and it's going to say the volume of each fill. So for example, 5 fills of 2,000 mLs. So you have to figure out how much total fluid am I going to need to have on hand in order to complete this procedure. So 2,000 mils per fill for 5 fills. 2,000 times 5 is 10,000. As Sasha said, our bags are 5,000 mLs each. So if I need 10,000 mLs total volume divided by 5,000, I'm going to need to ask the supervisor to bring me 2 bags of fluid.
We're going to set up the machine. The first thing to understand for inpatients is that we need to make sure that we're setting these up in time. It takes about an hour or two for the fluid to get warm. So what we have been doing on CCC is going around between 4 or 5 and setting up the machines and just leaving them there so they can set up. So day shift has been doing that, and then night shift has been the one actually connecting. So to turn the machine on when you come in with all your supplies, there is a little white toggle in the back here. You just flip it on, and then the machine will turn on. This screen you will see with every machine that we have. This IQ drive, because they use these machines at home, they get little USB ports that puts their settings in onto the machine. So for us, we don't use this, so we just hit the OK and bypass that. This does remember the last treatment that was done. So if this machine had been used on a previous patient and now you've got a new patient, you're going to have to change everything. So for us, we're going to have to change our settings for our patient today because he's new. So you would go to My Settings, and it looks like you want to push here, but you kind of have to push below for it to change. We always do treatments based, and then you do CCPD, and our orders will always say CCPD. In here, there are things that we can change and things that we cannot. The blue is the things that we are unable to change. Anything in yellow, we can reset. So the total volume, today we're just going to do 100. So you'll click on it, now it turns orange, and down arrow and go down to 100.
This slide has some screenshots on it that we're going to talk a little bit about of what your orders are going to look like. As Sasha said, your orders, this top screenshot, are going to say CCPD. This is the order that's placed by the renal doctor. And when they place this order, they're going to indicate the number of fills and the fill volume for each time. So, for example, this patient's going to have 5 fills. Each volume is going to be 1.25 liters. You can convert that to mLs so that you can do your math and determine how many bags of fluid you're going to need to request. This line here, the duration of cycler therapy, will let you know for your sleep time. Sasha talked about the last fill volume in the event that you had orders to leave fluid in the patient's belly for an extended dwell time. This would be indicated here. And then important part, the last line here is the dialysate concentration, 1.5%. You're going to need to look at this because that's also the type of fluid you're going to request from the supervisor is 1.5%. You'll also need to place an order per protocol for peritoneal dialysis solution. So you'll type that order in and it's going to come up with the options, and you're going to select the correct option based on what the order from the renal doctor says. So you would check the box 1.5% dextrose. That's going to bring up this details box that you're familiar with when you place an order for a medication, where the route will say peritoneal dialysis, and then towards the bottom of the details box, you'll click the hyperlink next to the green plus sign, add note to pharmacy. That's going to open up the box where you can free type in how many bags you will be using based on the math that you completed. I'll be using 2 bags of 1.5% dextrose. This order is going to place the solution on your MAR.
Okay, so my order for today was for my patient to have a total volume of 10,000. So you hit your total volume, and you just take your arrow up until you can hold it down. Put this up to. Sometimes you kind of have to play around with it a little bit so you can get everything to move. My order was to do for 9 hours, so I'm going to move it up, the total sleep time for 9 hours. And then I should be able to add to increase my volume. And it goes very fast. Sometimes it goes really slow and then it starts going really fast. And then each fill is supposed to be 2,000. So same thing, I'm going to hit my fill volume and then I'm going to hit up. And as you notice, as I change each number, my fills and my dwell time changes. So it now knows, so my order does say to give 5 fills throughout the night. And it knows that by what I'm programming in here. My patient has a 0 fill, a last fill, so we can do a last fill, and that would mean the fluid that stays in their belly throughout the day. Sometimes they want them to have like a long daytime dwell to pull other stuff out. But for our patient, he does not, so we're going to go to the last fill and make that 0. So by morning, he should have nothing left in his belly for the daytime. Once you get exactly what your order says, sometimes that dwell time might be a little off of what might be in the order. That's okay as long as you have these are the same as what the order says. You'll hit OK to save, and then you'll go back. That kind of saved it. You're going to go back to, once again, kind of below the My Treatment, and then you're going to see what you programmed right there. Okay, so now we just went through how to put in our settings, and so once you get back to My Treatment, it gives you the verification that you did, that you are doing for the night, and you're going to hit OK. It says to hit OK, you hit OK. The machine will go through a little bit of a setup, and you'll notice that there is a green bar. So whenever there's a green bar, that means the machine is doing its thing.